Deep brain stimulation has long been able to help in the treatment of movement disorders caused by Parkinson's disease. Now, a newly developed electrode from the University Hospital Würzburg could make much more possible. Not just pure stimulation, but also measurement within the brain.
For a long time, we used circular electrodes of platin iridium, which give an electric field that is like a ball shaped. The tissue that we want to influence is a very small area usually. The electrodes in this new lead, they are segmented. So there are 3/3 of one circular electrode now at the two medium levels, and thereby we can create very small electric areas. That means that we can deliver a very precise stimulation. We have implanted a couple of patients meanwhile. Practically, it is the same procedure, only we pay special attention so that the segmented electrodes are really placed at the area of the highest pathologic activity and also at the highest clinical effect that we test during surgery. So it's not only the electrode in the right area, but especially the segmented parts of the electrode that they are in this active area. And long term, we also don't see technical or biological problems.
Not only the more targeted alignment of the electrode field is new, one feature may have a significant impact on the future of deep brain stimulation.
This new stimulation device, deep brain stimulation device, offers, in addition to the capability to stimulate with directional electrodes, the capability of recording signals from the brain. And this is a unique feature. So in addition to stimulating very precisely circumscribed areas of the brain, few cubic millimeters, to focus basically the clinical effect of stimulation on symptoms and avoiding at the same time areas that may provide side effects, we can record signals from the brain, which give us some insight into the state of the brain. And as you may know, movement disorders are by no means constant. They fluctuate. They have a different symptom expression throughout daytime, but also with daily activities, they may change and fluctuate. And the idea is that we can record in the future signals which allow us to decode the state of the brain. For example, if someone is sleeping or performing certain activities, and then we can adapt the stimulation to exactly the needs of the patient in a particular moment.
The data is read out in the neurology clinic and then, together with events recorded by the patient, provides a whole new basis for further research and treatment.
The system allows to record in different modes. One mode is recording certain frequency bands of activity in the home environment of the patient. The idea is that one can use so-called spectral information about brain signals to identify certain states. So that's one application. But we can also record, but in a more laboratory environment. When the patient is coming to the clinic, we can record the full bandwidth of brain signals from the electrode, and this may help us to identify physiological markers of other brain states. For example, we are working in particular on the recording of gait-associated signals. So we want to identify when a patient is walking, and we want to identify certain gait phases and some problems associated with gait in Parkinson's disease, such as freezing, for example, such that we can adapt the programs of stimulation to a mode where in particular gait is improved. Big data analysis has been in the past very successful by applying artificial intelligence algorithms rather than deterministic analysis. Human-driven analysis, basically, because many of the features may be unknown to us. So it's very good to use a so-called unbiased data analysis approach by machine learning, for example, which may give us insights into the data that are beyond our current hypothesis. And this is exactly what we are doing with the data. Hopefully then in the future, when we are capable of better understanding these signals and defining different brain states from these signals, then we can adapt also the stimulator and close the loop between recording and stimulation.